load, if you will, the core load on the hospitals and other healthcare facilities, meaning their medical services, right? That is the core mission. Not utilities are not the core mission of a healthcare facility. And alongside this, we're also seeing a lot of new medical technologies also be introduced into the same space. So what we're seeing is a lot of physical growth or facilities growth, and we're seeing a lot of capital growth or capital spend in the healthcare arena around technology. So just like it's taking place in other segments of our businesses in North America, we're also seeing that in healthcare. We also have to go back to a fundamental, and we have to recognize that a hospital is an energy-intensive facility, or multiple facilities, or a campus of facilities, and they're often built out in quite a piecemeal fashion. Am I right? Folks who've worked in the hospital and healthcare community. All right, so what we're seeing is that in some places, these costs that are associated with, if you will, a piecemeal energy system that was developed as new wings were built onto the hospital net, that these costs are really starting to become a concern for the CEOs in the healthcare community. In fact, they rate it as a major concern looking forward to the next 10 to 20 years. And then a couple anecdotes from Ontario, and how many of you are aware of some of the electric rate issues in Ontario, specifically Ontario? Yeah, so one of the things is the global adjustment charge up there, and that's created a pretty healthy burden on non-residential customers. Non-residential meaning commercial, industrial, and municipalities, and healthcare facilities and universities are included in that. So what we've seen is, we've seen a few hospitals in Ontario actually cut medical staff so that they can pay their electric bills, okay? That's not a good thing to do, right? That's kind of counter to the idea of core mission and satisfying core mission. So we see some of these things happening. And then there's lots of stories, and you can read about them, about how various healthcare facilities and hospitals have struggled or have had to struggle in and around large storms or major storms, when the grid is challenged by these major storms. But what I think it's important to recognize is that when do you want the hospital or that healthcare facility to be at full strength, doing its core mission and beyond? Well, it's about the same time that the electric system is majorly challenged. Okay, so maybe we need to be rethinking some of this in a transformative way around the healthcare sector. So as I mentioned before, we're seeing a lot of growth in the hospitals. For example, if you take a look at what's a proton beam therapy unit cost on a hospital as an addition, as a CapEx addition. All right, somewhere between $30 and $110 million. So that's a very substantial project that a hospital undertakes to expand its medical services in a very high-tech way, in a very successful high-tech medical solution. But that means that that means that there's not CapEx available or capital available to do other things while you're majorly invested in something like that. So what we're seeing is a problem about decision making, or a challenge in the decision making of, do I do this or do I do that? You know, do I rob Peter to pay Paul? And what we want is, we want our healthcare industry to constantly improve, and that means in a technological way and in a medical services way. So core mission is really important in this area. And I can say that now because I'm almost a senior officially, and I really want my local hospital to be the best that it can be. One of the other things that we're seeing a lot in the healthcare arena is, in an effort to do that, a lot of healthcare facilities are looking at ways that we can be more self-determined in how we address our energy needs. And some of that is through conversions, like Chilcote was talking about, looking at the difference between a boiler technology and a CHP, and can I actually eke out some more efficiencies there and some cost savings and things like that. But also looking at how, in a compact space, how do I actually bring solar into the picture? How do I bring energy storage into the picture? How do I actually fit that into this maze I call a medical campus? But what we're seeing is that if you're going to be that high criticality player at the exact time that the grid is challenged, meaning a major storm, then you have to be looking towards those solutions that are not only going to drive an economic outcome, but also drive a reliability and a resilient outcome, or a resilience outcome. So there's a series of articles and a white paper generated around this whole thing, and there were 6 different articles created out of this just to explore different aspects of this whole question around healthcare and microgrids in healthcare, and how do you utilize distributed energy in this space in an effective way. And so and you can go out to Microgrid Knowledge website, and you can search for these. You can see all these articles. So that's what I'm talking about. I'm talking about some of the key learnings from each of those particular articles. A little bit about the architecture. If you take a look, and I think we need this for a discussion around microgrids, and especially from what it can do for a healthcare facility. So this is kind of the typical structure that you see in a hospital, where you've got many circuits there that are fed from the service drops or the point of common couplings that are at the healthcare facility, and then you have one or more critical circuits that are fed, that are capable of being fed by one or more emergency backup generators. Okay, typically diesel, sometimes natural gas, but often diesel, and actually some propane. But they're usually fed through an automatic transfer switch, right? So if the high side voltage or frequency is lost, then the ATS flips and the generators are hopefully already in a startup mode, and you can repower that critical load circuit with an emergency backup generator. So what you can do with a microgrid is you can kind of interpose that with another circuit that now is a generating circuit that you feed, and you coordinate it with your point of common coupling with the utility. Now notice I'm not doing anything with the ATS or anything with the emergency generators. Now, why would we want to do that? Why would we want to leave, I'll give you a hint, why would we want to leave that alone? I'm sorry? Yes. So you want to, there are, in almost all states, there are healthcare regulations that apply to the emergency backup generation. Why would that be? Life safety. Good. You're getting perfect answers up here. So the idea, it's a life safety issue, and there's lots of things associated with that, and it's highly regulated. So if you're going to bring a microgrid into a healthcare facility, maybe it's a good idea to stay away from those things which are related to the life safety, at least from a regulatory perspective, a healthcare regulations perspective, and focus on creating something that is more reliable and more resilient to the major storms and to the issues that are challenging the utility. In other words, let's go in and do something that stands in parallel with the utility, not with the emergency generation. Okay? So that's what we're talking about, is bringing a microgrid into the resources, the coordinated on-site generation resources, into that interposing area, and basically using it as a strengthening of a local strengthening or an on-site strengthening of the grid supply, right? And doing that all behind the meter. And that enables you to protect and actually increase the reliability of the circuits that feed into that ATS and therefore the critical circuits, and you reduce the likelihood of needing to depend on the emergency backup generation. But it is still there, left intact, to follow the life safety codes. Does that make sense? All right, so more reliable, right? We're not, in a sense, we're not directly affecting those critical circuits, but we are affecting the whole operation in general by creating a microgrid at that healthcare facility. The cost is always, if not the single largest driver, often, well, it is the single largest driver. And what we find is that there's a lot of things that are challenging the reliability of the electric system behind the meter within that healthcare campus. There are a lot of older hospitals that have been around a while, and their electric systems are equally old. So there are some end-of-life issues on some of the equipment and cabling and things like that that are there, and they are more challenged as you've added additional wings to that hospital and brought new loads in. So some of that can be, hopefully it was designed correctly, but sometimes we find increased loads and on pre-existing circuits, and they haven't been properly balanced between different phases of a three-phase system, and also spreading it across different feeds from the utility. So let me ask you a question. If you've got 3 feeds to a hospital, should you be using 2 and save 1 for backup, or should you use all 3? What's more reliable?
Using all 3.
Using all 3. Yeah, data would suggest that. I mean, there is a case you could make that, I got this one sitting here doing nothing that's available to take a certain amount of load. But generally, the operational data suggests that I should spread the load across multiple resources. All right, so there's a lesson in that for microgrid design. So if I'm going to bring a microgrid into this scenario, should I bring in one big unit, or should I spread the load? Should I spread it out and have multiple units and spread that across multiple circuits? That would, the data suggests, and there's been some interesting insurance analysis on that, looking at business continuity insurance that suggests I should spread the load. And I have actually higher reliability by doing that. And I should use multiple resources, and I have improved reliability from that. Efficiencies. There's a large push in a lot of states to not utilize fossil fuels. When you have a large thermal component to your load, is there a case to be made for utilizing combined heat and power, even if I'm in a state that doesn't particularly facilitate high efficiency or clean natural gas burning engines in a CHP environment? Is there a case to be made for that? Huh?
Yes.
Yes. A lot of us think so. Especially when you take a look at, if you're looking at a microgrid like I described, or I showed you an architectural diagram of bringing in PV and energy storage in a CHP unit or 2, and in that kind of structure, what we have found working with multiple healthcare facilities and multiple communities is that even if I've got a substantial natural gas-based component, I can still reduce my carbon footprint by 25 to 30% for that facility or that group of facilities in a campus. That's a pretty good movement. So making a community more resilient. So if I've got a healthcare facility that is able to operate through the worst storm, how does that help my community? helps it in a lot of ways, right? Now, if I have, but I've still created a pocket, right, of load and a pocket of services. So what if I take that and I extend that out to other areas? In other words, what if I make all the feeder urgent care centers and other clinics that kind of feed that hospital network or that community, what if I make them resilient as well? What have I done for that load pocket or that medical services pocket called the hospital? Have I made it better? Have I made it more able to provide the services needed? Well, some would say yes, is that I would, by helping the feeder network of other healthcare services and providers, I'm reducing the load and on the health services load. I'm talking energy and health services. It's interesting. Reduce that health services load, so therefore that hospital is more effective, and it can be more resilient from a mission critical perspective, not just from an energy perspective. So there's a case to be made that this whole idea of making a healthcare system resilient is not just at the hospital, but it is also at the rest of those core facilities that are around the community that help manage the triage and manage the load on that system, that healthcare system. So, and actually we've talked a little bit about this. So it's more than just backup generation. If you take a look at some data from the Northeast blackout in 2003, of course that's 14 years ago. But if you take a look at the 58 hospitals in the New York area, half of those had backup generator failures when it came time for those Black Start units to come online. And we saw many hospitals during Sandy have similar issues, maybe a little bit different cause. This time a lot of it was related to flooding and flooding the basements where the backup generation was. But it still shows that it's not, there's still some lack of resilience there, even when we're talking about our life safety systems. But if I have an operating microgrid, then I actually can maybe reduce that issue if it comes up. And I mentioned about the healthcare, it's not just for hospitals. I can spread the load and help the situation across the entire system. So what makes hospital microgrids a little bit more efficient, a little bit more green? Well, I mentioned a little bit about how the CHP, changing out a boiler and going to more of a CHP operation can help with that thermal efficiency. But there's also, the fact is, if you take a look at solar prices, as you all know, the PV prices have come down substantially. Not just the panel prices, but the whole installed costs. So all the installation costs and the integration costs that have also come down. So we are seeing about a 60% drop over the last few years in this space. So it's not uncommon to see a PV array that could be spread out across the upper decks of parking garages at a hospital complex, and maybe some roof space and that. And if you can gather up a megawatt of PV there as a 25-year asset, now you're talking at something on the order of about 8.5 cents as a long-term levelized cost of delivered energy. Now that's pretty comparable, some would even say competitive, with some non-renewable energy costs that you would see at that facility. So if we're starting to see some of that price parity come into play, why wouldn't I do that, right? So now I've got things aligned where being more sustainable is also more economic. So, and that's one of the things I think that we've seen as a shift over the last 4 or 5 years, is this idea that when I think about resilience, or I think about sustainability, I think about it as a cost in addition to what I'm currently spending. And what I'm suggesting to you is the data says a little bit different thing. It's saying that if I'm making a decision related to renewables and bringing renewables into the campus, that, you know, for the purposes of sustainability or carbon footprint reduction, I'm probably, if I structure it right, I'm probably also going to see some economic gain there as well. So things are becoming more aligned than they have in the past with this shift in the overall cost picture. So no money down. If you're trying to keep up with the Joneses in, or I should say Jones Hospital or Jones Medical Center, then you are making sure that your services are, you know, your new high-tech services and your the quality of service that you provide for your medical staff is improving all the time. And to do that, that takes a lot of energy, takes a lot of fortitude on the part of the hospital management and staff, but it also takes capital to do that, because much of this new technology that's improving healthcare are large capital spends, and therefore that's a core mission. That's where your your CapEx should be going towards, and that leaves how do I handle all my deferred maintenance? How do I handle the fact that I should be moving into I should do this capital expenditure on my energy system so I can reduce my OpEx, my operational expenses long term, and I don't have the capital to do that, or I have to decide whether or not I'm going to put a proton beam therapy unit in, or I'm going to upgrade my energy system. So we think that there's plenty of third-party financing approaches out there that enable the hospital to have its cake and eat it too. They can go ahead with their proton beam therapy wing and go ahead and upgrade your energy system across your entire campus, and do that through a third-party approach. So that's what we're seeing happen. Is a lot more of these projects, these microgrid projects, or these CHP projects that can be upgraded, if you will, in a phase 2 to a microgrid project. We're seeing a bunch of those become bankable from a third-party financing approach. And that is, in essence, a new model for the financial community, for the healthcare community to use the financial community in a different way. You're able to download some slides. Here's a couple, here's 4 real-world success stories around how healthcare microgrids have changed the nature of facilities and really caused us to look at the energy picture inside a healthcare facility, or even a healthcare group with multiple facilities, and see some of these things that we're talking about, where I get the alignment of better economics, better reliability, resilience, and a smaller carbon footprint. So I'd like to open it up for some questions.
We have just a couple of minutes. Any questions for Steve? So Steve, one of the things that we've seen is that the healthcare industry is in such flux, such uncertainty, that capital really is at a premium. Are lenders still interested in funding energy project upgrades? And is it a function of the credit quality of the institution? Is that a factor?
So the creditworthiness of any facility that signs up to a long-term power purchase agreement or energy service agreement is always a factor in the discussion. But there are organizations that specifically target. There are funding organizations that specifically target this kind of nature, and it's they're well, not only those, but also private entities. There are private equity groups, there are infrastructure funds that are specifically geared towards longer range, or let's say longer payback periods, to put it simplistically, and also critical organizations and groups in a community environment that do have some challenges with.
Does that require a certain level of financing threshold? Are they interested above 100 million?
No.
Or?
No, so that, more traditionally, that's true, but I mean, for example, we work with CROP, and this is a particular area of interest on the part of CROP who has a huge infrastructure practice, and to look at ways to bring the improvement in energy, because it's multiplicative, right, for the community, and bring that into the public-private partnership arena, bring that into the third-party funding, owner-operator arena, all to make, to leverage this. This is part of the infrastructure will make it a better place.
Make healthcare healthier.
Make healthcare a more healthful place.
You can use that term if you